Every year, thousands of lives are lost, not because help was not possible, but because bystanders did not know the right steps. That's why I will tell you how to act when someone faints or is unconscious. The most common such condition is fainting, which is a temporary loss of consciousness with warning signs. It happens when blood flow to the brain is temporarily reduced. The person usually feels dizziness, nausea, sweating, pale skin, sometimes tunnel vision or ringing in the ears, and then collapse. But recovery is fast. In 1 minute usually when person lying down. The person keeps breathing even when unconscious. It happens usually due to vagus reflex, which drops heart rate and blood pressure. It is common during prolonged standing in crowded or hot rooms, when seeing blood with pain, fear, sometimes even during urinating, coughing, or straining. Fainting is common in church or a bus or queue on a hot day after skipping breakfast. At a clinic during the blood draw or after painful news, sometimes after standing up quickly. If someone faints, the first thing you should do is check responsiveness and breathing. Speak them loudly, tap the shoulder, and look for normal breathing. If they respond or you catch them early, likely fainting, lay them flat, elevate legs, loosen tight clothes, cool the environment, and give them fresh air. Don't let them stand quickly. Offer water only when they are fully awake and not nauseated. Even they feel fine, they should remain lying down at least 10 to 15 minutes, because standing too soon can cause a second faint. If the person does not awake within 2 minutes or breathing is not normal, treat them as unconscious and call ambulance immediately. Unconscious is when a person is unresponsive to voice or to firm shaking on the shoulders. If breathing is abnormal, slow, irregular, gasping, or if they don't breathe at all. If pulse is very weak, very fast, or not felt at all. Sometimes there can be stiff body, jerking movements, or seizures. The tongue may fall back and cause noisy breathing, blocked airways, or choking. And unconscious duration is usually more than 2 minutes. Commonly, people become unconscious due to heart attack or sudden arrhythmias. In this case, there is a sudden collapse, no breathing, no pulse. It may happen due to stroke or brain injury. In this case, it can start with one-sided weakness or speech loss before unconscious. With seizure and epilepsy, there is jerking, tongue biting, incontinence, and then unresponsiveness. Now let's say what to do. First, check safety. Make sure that scene is safe. No traffic, no fire, no electric hazard. Then check responsiveness. If person is breathing normally but not responsive, you can guess if the person is breathing by watching the chest or belly for the movement. Rise and fall. Put your ear close to the mouth or nose to listen the air. Or put your cheek near the nose or mouth to feel the airflow. Do this no more than 10 seconds. The person should breathe normally, chest moves regularly, breathing sounds normal, and you feel air. If person is breathing normally but not responsive, if the person is breathing but not responsive, you should place them in recovery position. For the recovery position, first lay them flat, both legs straight. Take the arm closest to you and move it straight out to the side, so make it an L shape with the body. Now, take the forearm, bring it across their chest, place the back of the hand against the cheek closest to you. Take the leg farthest from you, bend the knee, So foot stays flat on the ground. Hold the bent knee and hand on the cheek. Gently pull the knee towards you so the whole body rolls onto the side. Once they are on the side, tilt the head back a little. Make sure that mouth is pointing downward. When we say mouth pointing downward in recovery position, we mean that person is lying on their side, their face is angled slightly toward the ground, not straight up. So if any saliva, blood or vomit comes out, it will drain on the mouth onto the ground, not fall back into the throat. If there are jerks or seizure, don't hold them down. Let seizure run its course. Clear space around them. Move chairs, sharp objects, anything dangerous. Protect the head. Place something soft, jacket, bag, or folded clothes under the head. Don't put anything in the mouth. No finger, no object, no spoon. This causes them more harm. Tongue biting is common in seizures. You cannot stop it. After the jerks stop, roll them into the recovery position. If there is difficult breathing or choking from the tongue and the airway with head tilt, chin lift, one hand on the forehead and tilt back, 2 fingers under the chin and lift up. Look in the mouth. If vomit or saliva, wipe or clear with a cloth or your fingers. If something solid is stuck, use your finger to sweep only if you can see it clearly. Don't blindly reach inside. Keep them in recovery position until they are fully awake and alert. This can be around 20 to 30 minutes or sometimes even longer. Monitor breathing at the time. If breathing becomes abnormal or they don't wake up, call emergency services immediately. If the person is not breathing, you should do CPR. CPR means cardiopulmonary resuscitation. Call emergency help immediately. Lay them flat on their back. Place one hand in the middle of chest, on the lower half of the breastbone. Place your other hand on the top. Lock your elbows and press hard and fast, about 100 or 120 times per minute, like beat of a fast song. Push downward about 5 to 6 centimeters deeper each time. Let the chest rise fully after each push. Continue chest compressions until person starts breathing normally or defibrillator is available or emergency team arrives and takes over. If you are trained for CPR with breath, after every 30 compressions, give 2 rescue breaths, tilt the head back, lift chin, pinch nose, seal your mouth over theirs, and blow until chest rises. Then return to compressions. If the person returns to normal breathing, stop chest compressions because pushing on the chest when the heart is beating can cause harm. Checking breathing carefully again for at least 10 seconds. Make sure it's regular and normal, not just gasping. If they are still unresponsive but breathing, place them into recovery position because this keeps the airway open and lets saliva or vomit drain safely. Stay beside them. Keep watching their chest movements. If breathing stops again, restart CPR immediately.